No. So that's why ultrasound longitudinal view after insertion is key. Now, here's the interesting stuff. On the left, I think she was on like a MICU or med-surg floor. One of my patients I went in for an assessment. I followed up with her too. I saw her before this, by the way. It wasn't like this before. I think it was 5 days in between when I saw her this time and then when her arm was okay. Nurses told, vancomycin. Nurses told her, hey, the burning's normal, it's okay. It's red, the redness is normal, you have an IV in there, vancomycin is a little, it hurts sometimes. Hey, it's burning, it's hurting, and it's swollen, and it's red, don't worry about it, it's fine, it's fine. And so she actually had necrosis of tissue. Do not gaslight your patients, please. Luckily, your patients are unconscious mostly, so we might not have to deal with that. However, be aware of the extravasation issue. This is a big problem, okay? Here's another one. That, I wonder if it'll play. I don't even know what they're running, but we have 1, 2, 3. Do you know what blisters mean with extravasations? Do you know what the implication is? When we see blisters from sunburns, how serious is it? I can't see bone. Maybe it'll slough a little bit, but you see like 1 or 2 blisters, right? And then what do? You go to the hospital for a sunburn, like a little bit of a blister, like 1 or 2? No, you don't go to the hospital, you just deal with it, right? Right. However, from an extravasation, think about this. The skin is the last tissue to be damaged. Does that make sense? The skin is the last thing to be damaged because we're chemically burning from the inside out, not from the outside in. Okay, so it's a much more serious problem. Let me get really existential with you guys. This is the last picture of this man's arm that exists in all the known universe, in all time, forever. This is the last picture of this man's arm. They had to amputate. This is a bicarb infiltration. All right, and first of all, it's in the elbow. I mean, look at that. You can see that it's puffy at that insertion site, right? So that man had infiltrated bicarb, and there's no antidote for bicarb, right? Okay, good. They're the experts. So let's raise the bar for our patients. I know I went through a lot of like really high-level fluids and math and stuff like that. But I think it's going to be important for you guys to succeed in giving the patient the best care with less suffering for them.